my name is Megan Ferry and I'm the clinician today. Raeanna is my client. Today is October 26th. Raeanna, can I first start by getting your age?
25.
25 years old. Perfect. Alright, the first thing I'm going to do is I'm just going to sanitize our area. Make sure it's all clean and all the germs are gone. Alright, the next thing I'm going to do is I'm going to wash my hands. And then I'm going to put some gloves on just to further prevent any germs from getting on me. So today's purpose is just to do your oral mechanism exam. It's just looking at the structure and the function of your oral cavities and the surrounding structures just to make sure they're not affecting your speech sounds. So don't be nervous, it'll be really easy. Alright, so the first thing that we're going to do today is we're just going to look at the structure of your face. So I'm just looking for any drooping or any movements that are unnecessary, so everything looks good so far. I'm not seeing any abnormal movements. I can also tell that you're breathing through your nose instead of your mouth, which is good. Alright, so the next thing we're going to do is we're going to look at your jaw. So if I could just have you open and close your mouth. So nice and slow, just open and close. Open one more time and close. Good job. Everything looks great. You have normal movement. You're not moving one side to the other, which is good. Next, I'm going to have you open and close your jaw again, but this time I'm going to place my hands right on your jaw to see if I can feel any clicking, popping, or any rigid movement. Alright, can you open for me and close? Good, one more time. Thank you. Everything looks good. I'm not hearing any movements or anything that I shouldn't hear. Alright, the next thing we're going to do is I'm going to use a tongue depressor to help look at your teeth just a little bit. So I'm going to get you to smile, and then I'm going to use the tongue depressor to pull back your gums just a little bit. Alright, can you smile for me? Good. Your molars look good. I'm not seeing any stains on your teeth, so I can tell that you're brushing your teeth very good. All your teeth are also present, which is great. Alright, the next thing we're going to look at is your lips today. So for the lips, I'm going to be using a tongue depressor at certain points. But the first thing I want you to do is I just want you to pucker your lips for me like a kiss. Good. Alright. Everything looks great with there. Now I'm going to use my tongue depressor. So when I put the tongue depressor on your lips, what I want you to do is just push it away. Alright. So make a kissy face. And push. Alright. So really push for me, okay? Alright. Thank you. Alright, I'm not seeing any abnormal colors or scar tissue, which is good. Alright, the next thing we're going to do is we're going to smile. So could I just get you to smile real big for me? Good. Alright. And smile one more time. I'm just wanting to check your symmetry of your smile, make sure everything looks good. Alright, thank you. Alright, can you puff up your cheeks for me like this? And hold in your air. Alright, just some feeling to see if any air is escaping. Good, you can release that. Alright, I want to check and see also if you're sending some air through your nose. So this time we're going to puff up your cheeks one more time, and I'm just going to use a mirror to see if any air is going. Good, thank you. Alright, now we're going to look at your tongue. So first, I just want you to stick out your tongue. I'm just looking for color of your tongue and symmetry. Good. I don't see any abnormal movements. Alright, the next thing we're going to do is we're going to stick out our tongue one more time. Good. Can you pull it back in? Very nice. Alright, we're just going to look at the strength of your tongue. So I'm going to take the tongue depressor again. You're going to stick out your tongue and you're going to push against the tongue depressor. Ready? Push. Very nice. Thank you. Alright, so can you stick out your tongue one more time? And then pull it back in? Very nice. Alright, now I want to see how fast you can pull your tongue in and out. So you're going to stick your tongue out and pull it back in as quickly as you can. So, good. Very nice. Alright, next I'm going to have you move the tip of your tongue, which is the very end, to the right. So it'll be my left, your right, so you're going to come this way. So first, can you just stick your tongue out and then move it this way? Very nice. Alright, now you're going to stick it back out straight and then see if you can push against my tongue depressor. Very nice. we're going to do the same thing, but now we're going to go on to the other side. So I'm going to take the tongue depressor. You're going to stick out your tongue and see if you can push it to this side. Very nice. Good job. Alright, now we're going to move our tongue up toward our nose and down toward our chin. So can you stick your tongue out and push it up to your nose? Alright, thank you. Let's try one more time and see if we can move our tongue up without moving our head. Good. Alright, now we're going to move our tongue down toward our chin. So can you stick your tongue out toward your chin? Good. Alright, let's try one more time, but can you try without moving your head down? So watch me. Try to do it without moving your head. Better, thank you. Alright, now we're going to move our tongue side to side, just like we did, but this time we're going to go a little bit quicker. So if you want, you can take your tongue and follow my finger. We're just going to go side to side as fast as we can. Good, thank you. Alright, so now I'm going to use my pen light and my tongue depressor one more time. We're going to look at your pharynx. So I'm going to push down on your tongue just a little bit and have you tilt your head back just so I can see if there's any discoloring or if your tonsils are present or absent. Good. Can you tilt your head back just a little for me? Thank you. Alright. Everything looks good there. Alright, now I'm going to get you to do it one more time. I'm going to take the tongue depressor, I'm going to push down, I'm going to look at your hard and your soft palates. So I'm just looking for color, size, so how wide it is and how flat it is, if it is flat, any growths, or if there's good symmetry. So I'm going to use my tongue depressor and I'm going to get you to tilt your head back. Good, everything looks great. Alright. So we are now going to look at the gag reflex. So I'm going to use my tongue light, or my pen light again, and my tongue depressor. I'm going to press back to see if your gag reflex is present. I'm not going to go too far back though, so don't worry. Ready? Thank you. Everything looks normal. Alright, and now we're just going to say the sound ah, and you're going to open your mouth up as wide as you can. I'm going to use my tongue depressor just to make sure everything is intact with your uvula. Alright, so ready? Ah. Good. I see proper movement, good symmetry. Everything looks great. Alright, so the final thing we're going to do today is we're going to get some rates of sounds. So we have 4 sounds that we're going to work on, and one of those 4 is just a combination of sounds. So the first sound that we're going to work on is pa. So can you say the sound pa for me? Pa. Good. Can you say it one more time? Pa. Alright, now let's do it 3 times fast. So pa, pa, pa. Pa, pa, pa. Good. So what you're going to do is you're going to say the sound pa 20 times, and I'm going to time you. I'll tell you when to go, and I'll tell you when to stop. Are you ready? Go. Pa, 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 pa. Good. Stop right there. Thank you. Alright, the next sound that we're going to work on is ta. So can you say ta? Ta. Good. Can you say it 3 times fast? Ta, ta, ta. Ta, ta, ta. Good. Same thing. So I'm going to get you to say the sound 20 times. I'll tell you when to go and I'll tell you when to stop. Ready? Go. Ta 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 ta. Good. Very nice. Alright. The last sound that we're going to do before we combine them all together is ka. Can you say the sound ka? Ka. Good. Say it one more time. Ka. Alright, 3 times fast. So ka, ka, ka. Ka, ka, ka. Alright, so same thing. We're going to say it 20 times, and I'm going to tell you when to stop and when to go. Alright, ready? Go. Ka, 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 ka. Good. Stop right there. Alright, now we're going to combine the sounds. So we're going to say pa, ta, ka. Can you say that for me? Pa, ta, ka. Alright, can you say it a little bit faster? Pa, ta, ka. Good. So this time we're only going to say it 10 times. So I'm going to time you. And ready, go. Pataka, 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 pataka. Good. Very nice. Alright, and you're all done today. So I'm just going to remove my gloves. Actually, I can edit this. I'm going to put them back on. I'll edit this, I promise. So I need to to clean the area first. Alright, so I'm just going to clean up our area. Get rid of our trash. I'm going to take my gloves off. Then I'm going to wash my hands. And you're all done. Thank you.
Okay.
My name is Megan Ferry, and I'm going to be the clinician. My client is Kayla, and we are doing the oral mechanism exam on October 26th. The first thing I'm going to do is, can I get your age, please?
23.
23. Perfect. Alright, I'm just going to start off by sanitizing our area, making sure that we get all the germs taken care of. Okay, and then I'm going to just sanitize my hands. I'm going to put on my gloves. How are you doing today?
Fine.
Good, it's been a long day, hasn't it? I'll make this short and sweet. Alright, so the first thing we're going to do is we're just going to move through the structures just to make sure everything is intact and not affecting your speech sounds. And then at the end we'll get some speech sounds and I'll time you just to see about how long it takes you to produce the sounds. The first thing I'm going to do is I'm just going to look at your face. So can you just look at me? Alright, everything looks good and symmetric. I don't see any abnormal movements. I do notice you're breathing through your mouth. Do you have a cold?
A little bit.
Okay, good to know. Alright, the next thing we're going to do is I'm just going to look at your jaw. So I'm going to get you to open and close your mouth. So open and close. Good, everything looks good. Your movement is symmetrical. Next I'm going to place my hands on your jaw and I'm going to get you to do the same thing. Just open and close your jaw. Good. I'm not sensing any movement or popping sounds, which is a good thing to notice. The next thing I'm going to do is I'm just going to look at your teeth. So if I could get you to smile. Good. Now I'm going to take the tongue depressor and just pull your gums back and look at your molars. Good. You have a good smile. Everything is where it should be. All your teeth are there. It looks like you do a great job brushing your teeth. Alright, the next thing is we're going to look at your lips. So could you make a puckered lip or like a kissy face? Very nice. Good. Now I want you to do the same thing, except this time I'm going to push against your lips with the tongue depressor. Ready? So can you push? Good. Thank you. I'm not seeing any scar tissue or any abnormalities with your lips, which is good. Alright, now I'm just going to get you to smile. Can you smile for me? Good. Alright. The next thing we're going to do is I'm just going to check to see if any air is escaping out of your nose or your mouth. So could you close your lips and puff up your cheeks? Good. I'm not feeling any air escaping from your lips. You can release. This time I'm going to use a mirror and I'm going to look underneath your nose to see if anything is escaping from your nose. So close and puff your cheeks. Good. Everything looks great. Not seeing anything emitting from the nose. Alright, so the next thing we're going to do is we are going to look at your tongue. So what I'm going to do is I'm just going to have you stick your tongue out for me. Good. The color and size, shape look good. Now can you raise your tongue so I can see your frown? Very nice. Alright, so I'm going to get you to stick your tongue out one more time. I'm just looking to see if it's moving to the left or the right when you stick it out. Good. Now can you pull it in and out quickly? Very nice. Alright, now I'm going to use my tongue depressor again. What I want you to do is just stick your tongue out and push against my tongue depressor. Very nice. Alright, now same thing. We're just going to stick our tongue in and out. So I'm just looking to see if you can retract the tongue quickly. So stick it in and out. Very good. Everything looks great. Alright, so now you're going to move your tongue to the right. So you're going to move your tongue this way. Very good. And I'm going to take my tongue depressor and I just want you to push against the tongue depressor. Very nice. We're going to do the same thing except on this side. So can you stick your tongue out to the left? Alright, now push against my tongue depressor. Great job. Alright. now we're gonna take our tongue and we're gonna move it up toward our nose and then down to our chin. So we're gonna start going up to our nose. Can you stick your tongue up to your nose? Good. All right, now can you move your tongue down to your chin? Very nice. All right, now we're just gonna move quickly side to side, and you can follow my finger if you'd like to. So ready? Very nice, great movement. All right, so I'm just gonna use my pen light and my tongue depressor one more time, and I'm just gonna evaluate the pharynx, check and see if your tonsils are there, if they're enlarged or anything is irregular. So can you stick your tongue out? Good, I see your tonsils are a little enlarged. You said you aren't feeling well?
Yeah.
All right, that might be why. All right, so I'm gonna use my pen light again, and this time I'm just looking at your hard and soft palate. I'm gonna use the tongue depressor just so I can get a better view, but if you could stick your tongue out, tilt your head back, and I'm just gonna look up there. Good. You have a good arch height and width. I'm not seeing any growths or anything irregular. And good symmetry. Everything is looking very good so far. All right. Next, what we're going to do is gag reflex. So I'm just going to take the tongue depressor and I'm going to put it back towards the back of your throat, but I'm not going to go too far. All right, ready? Good. I see that reflex is intact. All right, now the next thing we're going to do is I'm just going to get you to say the sound ah or ah as you open your mouth very wide, and I'm just going to check to see if you have good uvula movement. All right, ready? Can you say ah? Good. All the movement looks good. I'm not seeing anything that shouldn't be there. There's no nasality. Everything looks great. All right, so the tough part is over. So now what we're going to do is we are going to work on some sounds. I'm just going to time you while you make these sounds to see about how many sounds we can make per second. So the first sound that we're going to work on today is pa. Can you say the sound pa? Pa. Good. Can you say it 3 times fast? Pa, pa, pa. Pa, pa, pa. Very nice. Okay, so I'm going to time you, and I'll tell you when to start and when to stop. And I just want you to say the sound pa 20 times as fast as you can. Ready? Begin. Good. Stop right there. Very nice. All right, the next sound that we're going to say is ta. Can you say ta? Ta. Good. Can you say it 3 times fast? Ta, 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 ta. Good. All right, same thing. We're going to do it 20 times. Ready? Begin. Good. Very nice. All right, the last sound we're going to work on is ka. Can you say ka? Ka. Good. Can you say ka, ka, ka? Ka, ka, ka. Very nice. So same thing. We're going to say it 20 times. Ready? Begin. Good. Stop right there. Very nice. All right, the last sound is a combination of the 3 sounds that we just worked on. So it's pataka. So I want to get you to practice it with me. Ready? Pataka. Pataka. Good. Can you say pataka 3 times fast? Pataka, pataka, pataka. Very nice. All right, so this sound we're only going to say 10 times, and I'll tell you when to begin and when to stop. Are you ready? Begin. Pataka, 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 pataka. Very nice. All right, you are all done with your sounds. All right, so I'm just going to clean off our area one last time. Remove all the items in the trash. Take my gloves off. And I'm going to wash my hands. And you're all done. Thank you for everything.